Louise, thank you for coming here
Thank
today.
you for having me.
How did you find Malta, first of all?
Oh, it's absolutely beautiful. I'm so delighted to be here. It's been a life dream to get here, and finally, thanks to Ingrid and all the crowd, now I'm here. It's great.
That's lovely. And you come from Ireland?
I do, from
From
Dublin.
Dublin? Yes. That's
Yes.
also a beautiful city.
Yeah, we're beside the sea as well. So.
What you do is, I find very, very interesting, and I think so do many people. How did you start doing this?
I have been doing beauty therapy for about 20 years, and it was my mother who really pushed me into beauty therapy. As I said to the others today, I really wanted to work with horses. It was completely different ambition of mine. And with her encouragement, I started doing beauty therapy, and I absolutely loved it. And then about 7 years ago, my mother was diagnosed with cancer, with ovarian cancer. And she loved her beauty therapy, her beauty treatments. She never went without. Every month she had her facial, and it was a really big part of her life. When she was diagnosed with cancer, I realised, actually, I'm not qualified to treat you. So when she asked me for a massage, I said, no, I can't treat you. And she said, why? And really, I couldn't answer. I didn't know the answer. I said, because in our training, when we do beauty therapy, we are told, no, cancer is a contraindication, meaning we can't do the treatment. And when I searched, I went on the internet and I searched for answers, I couldn't find what I was looking for. And then my mum went through chemotherapy, and afterwards, unfortunately, her cancer was back and she was terminal. And at this point, her doctor said, you can work away, you can do whatever treatments you want, because you're not going to do any harm, you're not going to do any more. And I did. And even in her last few weeks, she still wanted her massage and she wanted her creams put on. And
How lovely
again,
that
this was
is.
really important to her, and it was a very special time for us. It was one-to-one. But I found that creams that she had used all her life, now they didn't have the same reaction with her skin. Some were adverse reactions.
So there were a lot of side effects.
There were side effects. And the massages, when she wanted to have, normally she would love a really long massage and she would relax, and it could never be too long. But yet when she was unwell, and she seemed well in herself, but she still had cancer, and she wanted a shorter massage. Mm-hmm. So where she wanted an hour or an hour and a half, now 20 minutes was more than enough. So all of these things kind of planted seeds in my head. And why does she want it shorter? One nurse might suggest one thing, another would suggest another. So sure. I couldn't find any definitive answers. Unfortunately, shortly after my mother passed away.
I'm sorry to hear.
And thank you. And it was, I had my second child shortly after, and it was about 1.5 years, 2 years later, I really got back into work, back into the salon, and all these questions came back. My clients that had been coming to me for many years came back, and some of them had cancer. And now, because they knew what I had been through with my mom, what she had gone through, they were happy to talk about it, and they were more open, and they talked about their experiences. And these were people that I had known for many years and never realised that maybe they had gone through breast cancer, or yes, maybe a loved one had gone through the same. But now they felt comfortable.
There was more of a stigma about cancer and speaking about it. And very fortunately, things are changing, because I also believe when a patient is able to open up, their problem
yes,
is shared, and it's like a weight off their shoulders.
Yes, it's halved. And as a beauty therapist, we're not family, and we are neutral, so they feel that they can open up, they can trust us, everything is confidential, and yes, they can really open up and get a lot off their chest.
So in a way, your work seems to be, to me, a tribute to your mother, really.
Absolutely,
yes,
absolutely. And
I have a beautiful thing to do.
I have a very strong goal. My business, my livelihood is my salon and my treatments that I do in there. teaching oncology.
So you specialise in oncology aesthetics?
Yes.
Yes.
I also treat everybody, all my clients, from whether they're compromised by cancer or not, they come to me for beauty treatments. And skincare is really what I would specialise in a lot. But spreading the word and really bringing oncology aesthetics and the importance of really bringing the risk. There is a risk there within the beauty salon that people don't realise.
Yes.
And it's a risk that can be very, very easily remedied. So that people
you can overcome it. If you know what you're doing, you can overcome that risk.
Yes. I have clients who have been told, no more massage, you can't have any massage. And then after I studied oncology aesthetics and I spoke with their doctor and we had letters back and forth, they said, oh no, you can have massage because now this lady is trained, she knows what she's doing. And that was very, very important to people that may be their thing. I have one client in particular, she said, she doesn't drink, she doesn't go out, she's not into makeup, massage, she goes for a massage every couple of weeks and that's her thing. And she was diagnosed with breast cancer and had treatment, and because of the treatment that she had, her doctor advised that she does not have massage anymore. Mm. After I spoke with her doctor, he said, yes, absolutely, she can have massage, but we avoid certain areas and we change the treatment. Sure. And she always sends me so many messages. She's forever grateful for
lovely.
this.
What are the side effects if a beauty therapist does not know what they're doing, if they use the wrong things?
Yes. Unfortunately, if a therapist doesn't know exactly what they are doing, they may be a very good beauty therapist, they may run a really, really good salon, a very clean salon, but if they do a regular manicure, for example, on somebody who has had breast cancer and have lymph nodes removed or radiated, they can cause an infection or they can cause something called lymphedema, which is a nasty problem that people really don't need to deal with and can cause very, very serious problems. That is just one example.
What are the side effects of this lymphedema?
So lymphedema is where if somebody has had lymph nodes removed or radiated, our lymph system is like our waste system. So it drains the toxins from our body. And they drain into certain areas. So like under our arm and our groin, there's your neck, there's different areas that have clusters of lymph nodes. If somebody has had a breast cancer and they've had maybe lymph node clearance under their arm, the lymph cannot drain properly towards here. So if we do a manicure and maybe they get nicked with the tools or even with a file, it can be so tiny, like a paper cut. That can cause an infection, that can cause lymphedema within the arm, and lymphedema can turn into cellulitis. It's a swelling in the arm, can be very uncomfortable.
Swelling of the arms, perhaps lack of circulation.
Circulation, and there are different grades, and sometimes it is irreversible. So it's very serious. It is a very serious problem that needs to be seen to by their physician.
How did you find your course here in Malta, giving a course to beauty therapists here?
It was fantastic. I was overwhelmed by the response and by the enthusiasm, and people seemed, blown away by the knowledge and
that you were sharing.
That what I was sharing today, and they just wanted more. Unfortunately, we only had a short time, but hopefully we'll be able to teach them more.
Unfortunately, cancer is, I would say, the number one killer, really, perhaps with heart disease also, and it's growing. And how important do you think that beauty therapists should perhaps focus on this topic?
It's a huge importance, because really with the statistics the way they are, 1 in 2 people will have cancer in their lifetime. And cancer now, rather than being a terminal illness, it is becoming a chronic disease that people are living with every day. So people, beauty salons and beauty therapists are going to encounter people who have or have had cancer. So these threats, the likes of lymphedema, is not just during chemotherapy or during cancer treatment, it's lifelong. So for somebody who wants to get on with their life normally and they still want to go and see their favourite beautician and chat about whatever they want to chat about and get their favourite makeup done or their nails done, it's really, really important that we give our clients that and the comfort that they know that they can have these treatments safely, that there's going to be no harm, and they don't have to think about the cancer that they had or that they have at every minute, that they're safe in our hands. We know what we're doing.
So, I mean, the way I see it is that every beauty therapist who has a large clientele or a medium-sized clientele really should invest in this sort of thing if she'd like to really look after her clients, because the probability is that it will touch some of them.
At some stage it will.
Yes.
I feel it's our responsibility. I really do feel it's our responsibility to look after our clients that have been loyal to us and given us our livelihood and will continue to do so in the future. I think this is very important.
Will you be coming again to carry on with this intensive education that you're providing?
So the plan is to be back in April of this year to do our first foundation level OTI training. It's a 3-day course, and hopefully all going well, that's when we'll be back. So
that's great. I mean, I know you're working in partnership with Ingrid Colero.
Yes, she's fantastic.